What if the persistent mood symptoms you're seeing in your female patients, particularly during reproductive transitions, aren't solely psychiatric in origin? What if they reflect neuroendocrine changes that remain unrecognized, or worse, misdiagnosed? We now know that sex hormones are not peripheral to psychiatric care. They're central to the regulation of mood, cognition, stress response, and neuroplasticity. And yet, most clinicians have not been trained to assess or manage hormone-related mood disorders systematically. This webinar aims to change that. From premenstrual dysphoric disorder and perinatal mood disturbances to cognitive and affective changes in perimenopause and postmenopause, hormonal transitions are associated with significant vulnerability for psychiatric symptoms. These are not fringe issues. PMDD affects 3 to 8% of women. Up to 20% experience moderate to severe PMS, and menopausal mood disorders are frequently misclassified as primary depression or anxiety. Even more critically, psychiatric conditions such as bipolar disorder, PTSD, and schizophrenia demonstrate sex-specific patterns of expression, fluctuation, and treatment response, linked in part to the hormonal milieu. In this clinically grounded and evidence-informed session, you'll learn why reproductive hormones matter in mental health across the entire female life cycle, how to distinguish hormone-driven mood disorders from primary psychiatric conditions, how to approach prescribing of hormonal contraception, menopausal hormone therapy, MHT, and adjunctive hormone strategies within psychiatric care, how to evaluate risk-benefit profiles, manage contraindications, and respond to common patient concerns, when to initiate hormone therapy, and when it may do more harm than good, and critically, how to bridge the gap between psychiatry and endocrine health. To take us deeper into this essential and evolving area of practice, we're joined by an expert whose work has transformed how clinicians approach women's hormonal health. Introducing Dr. Ceri Cashell. Dr. Ceri Cashell is a leading voice in women's hormonal health, specializing in menopause, perimenopause, and hormone-related mental health issues. She has 20 years of experience as a practicing GP and co-founded Healthy Hormones, Australia's largest online menopause community for healthcare professionals. She is passionate about raising awareness of how sex hormones influence physical and mental health across the female life cycle. She advocates for a holistic, personalized approach to menopause care, integrating nutrition, exercise, and hormone therapy to improve the quality of life and reduce the future risk of disease. Beyond clinical education, Dr. Ceri is a medical writer, public speaker, and women's health advocate, challenging outdated medical norms to ensure women receive the support that they need with confidence and clarity during perimenopause and beyond. Through Healthy Hormones, she helped organize the groundbreaking So Hot Right Now event series, which brought international thought leaders to Australia. This included a public event for 2,500 women at the Sydney Opera House and an independent GP-led medical conference on menopause. If you're a psychiatrist, GP, or mental health clinician looking to refine your diagnostic accuracy, enhance treatment outcomes, and practice with greater confidence in women's mental health, this webinar will make a difference. It is our privilege to introduce Dr. Ceri Cashell. Welcome.